Prior to the treatment, an iodine sweat test is performed. This simple test will highlight the exact location of the sweat glands. This information then assists the practitioner when they undertake the procedure. Alcoholic iodine is painted onto the surface of the underarm and left for several minutes to dry. A fine dusting of cornstarch is then applied over the iodine area on the underarms. The areas where an overactive sweat is produced will turn the iodine black in colour. Cornstarch reacts with water and turns it black, hence the colour change. This test can be repeated during subsequent reviews to assess whether the overactive sweat glands have been destroyed following treatment. A local anaesthetic is injected into the area of the underarm prior to treatment. This may sting a little, but ensures the procedure will be comfortable and not painful for the patient. Once the area feels numb to the patient, the treatment can start. A template is then applied to the underarm area. This leaves a temporary grid tattoo on the surface of the skin and allows the practitioner to be able to map where the procedure is going to be performed. This allows and helps provide an accurate guide for the placement of the handpiece during the procedure. The miraDry handpiece is then placed onto the surface of the skin. An energy is emitted from the machine through to the handpiece, and the energy from this is then used to destroy the sweat glands. The miraDry system uses microwave thermal energy to destroy the underarm sweat glands that cause excessive sweating, targeting both the apocrine and eccrine glands. The apocrine glands are the sweat glands that produce the sweat with the odour and sit alongside the hair follicle. The eccrine glands are the glands that create the wetness or water on the skin. The number of miraDry procedures that a patient needs will vary depending on the extent of the sweating. For most patients, 1 or 2 treatments will be enough. A gap of 3 months is left between each procedure, allowing for full recovery and to be able to assess the amount of sweating that still remains in the area. It is unlikely that a miraDry procedure will give 100% bone dry feeling to the underarm area, but in most cases people can expect about a 70% improvement and reduction of sweating to a normal, socially acceptable level. This process continues until the entire area marked with the temporary tattoo has been treated completely. At this point, the procedure is then finished. Immediately after the treatment, ice packs are put onto the underarm area to help reduce the heat that's produced, bruising and swelling. The local anaesthetic lasts for approximately 2.5 hours post-procedure, allowing most patients to get home in comfort. After the miraDry procedure is complete, ice packs are applied to the area. It is recommended that these ice packs are applied regularly to the underarm area for 48 hours post-procedure, and paracetamol is taken as and when required.
For more information, please click one of the links above.